anywhere, anytime on your phone. How? Go to WHBC.com, the iHeartRadio app, TuneIn, and radio.com.
If I can't listen to you live, I always go to the podcast.
Hey, Alexa, play 1480 WHBC.
That's where everyone goes for local news, weather, and traffic.
News Talk 1480 WHBC. We go where you go.
WHBC.com. 1480 WHBC has always been there for you.
We here at 1480 WHBC continue that work.
Find more right now on WHBC.com.
Live from the WHBC Broadcast Center. Find out more about area businesses, agencies, and events.
It's what's going on right now.
This is Spotlight.
And again, and as every single Wednesday, we love to do this program, Spotlight on Stark County. And we are today talking to the folks at Discount DrugMart. And, you know, this is obviously a business that is on the front lines of our COVID response. People are always having to go to get their prescriptions to take care of their health and all of those things at this time. So we thought this might be a really important thing to discuss today. And we have with us this morning Chris Peshek, who is the regional pharmacy supervisor with Discount DrugMart. Hi, Chris.
Good morning.
So let's start off talking a little bit about COVID-19, because obviously that's the biggest thing on folks' minds these days. And what was the response for Discount DrugMart? I mean, that was probably something you guys really had to think through and make sure you could serve your customers in the best way.
Yeah, it's definitely been challenging. Finding that balance between complying with all the state and federal mandatory guidelines and also keeping our employees safe and keeping our customers safe as they shop in our stores. We've been doing kind of some of the things you would expect as far as sanitizing work surfaces regularly, high touch surfaces, carts. We've been requiring masks, which is now required in Ohio anyway, temperature checks for all employees. And one thing that we've kind of done is create a little hour every day for high risk customers. So from 9 a.m. to 10 a.m., some customers try to come to the store when it's a little less crowded. So we've kind of carved that out for them. But it has been an interesting time. We've always considered ourselves an important part of the community healthcare, but we didn't quite know what all would come with being considered essential now. So.
Yeah. And, you know, when I think about going to the pharmacy and going to Discount DrugMart, it is one of a place that I probably would feel safe. I would certainly go there feeling safe. But I would imagine that there are people, when you set aside that hour, do you find that you have those folks coming in during that hour because they are afraid to come maybe at different times of the day?
I think some of the more cautious customers or more cautious shoppers seek those hours out and specifically try to come during those hours. Then again, I'm sure we have customers who just kind of come in when it's convenient, regardless of whether it's an hour that's carved out just for them. And some of those customers we've recently started, because of all of this, free prescription delivery. And so if a customer is high risk, or maybe they're not high risk, but they're just a little bit wary of being out in public right now, and they can't make it in during that kind of carved out hour, or even if they can, they still don't feel quite comfortable with that. We started this free prescription delivery so that customers can get what they need and still stay at home if that's what they're doing. So.
And what about on the other side of it for your employees? You know, I'm sure that there are things that they're doing also to keep themselves safe, right?
Yeah, we've been doing, of course, the masks while at work, and we've been doing hand sanitizers all over the place, and as much as possible trying to remain 6 feet apart from each other while we're back in the pharmacies working, and all throughout the store, for that matter. I've just happened to be more familiar with the pharmacy aspect of our business, but and for the most part, we've been pretty successful at that. We've had safe, relatively no incidents of COVID for the most part, compared to maybe some other areas or compared to the general population. So far what we're doing is working. Hopefully that continues to be the case
And when you talk about pharmacists and going to a pharmacy, many times, I think back, when I was a kid, that was like a person that my parents knew, and that the neighborhood pharmacist was the guy, that you went in and talked to and asked questions of and became very familiar with. And I would imagine that it's still like that today for you guys, that, you have to familiarize yourself with the folks who become customers.
Yeah, that's something we've always taken a fair amount of pride in, is that relationship between the pharmacy and the patient. At least from my experience of working for a few different companies with DrugMart, there generally seems to be a really solid relationship between customer and pharmacist, where somebody comes in and the pharmacist seems to know everything about their family and what's going on. They ask how how that headache cleared up last week and that kind of thing. So that's always really nice to see. It's not just a kind of no name number kind of situation for the most part. So, and what's been unique about the current period of time and that relationship is that a lot of customers, because they have that relationship with their pharmacist, are feeling comfortable coming in and asking questions and looking for resources, and everything from, do you know how to make homemade hand sanitizer, all the way up to questions about something that somebody maybe heard in the news about a up and coming treatment for COVID, or a test about COVID, or a vaccine for COVID, or all those kind of things. So we've been able to be a kind of a source of information for our local communities.
Let's talk about that a little bit, the testing and the vaccine. Some places are testing sites. Is that something that DrugMart has thought about or plans to do at all?
Yeah, we've back when, and the state of Ohio, I should say, has been great as far as the state board of pharmacy has been really nice in utilizing pharmacies and pharmacists as a resource for everything that's going on. But with testing specifically, we've been working on some protocols. Step one is getting the tests, which are still not completely in full supply. And then step two is training our people on how to use them. But we've come up with a plan for when that happens, on being able to do tests at our pharmacies after all those boxes get checked. So, okay. And it'll be, when the time comes, it'll be a safe thing where we'll most likely utilize our drive-throughs so that people who think they might have COVID or are having symptoms are not coming into the store to put other shoppers at risk and that kind of thing.
And I know, when we talk about vaccinations and things like that, obviously flu shots come to mind right away. But the process will come a time, hopefully soon, in some way, shape, or form, we're going to have a vaccine for COVID-19. Is that something that you're preparing for too?
Yeah. So not here yet, obviously. I'm sure we'd all know about it if it were. But when that time comes, just like every other vaccine in the state of Ohio, pharmacists are able to administer it. And it seems like every year, customers and patients seek out a pharmacy to get their vaccine as opposed to a doctor's office, just because there's usually less of a wait. A lot of times you don't have to pay an office copay, so it can be more affordable. It's faster. It's a little bit more convenient. You can come in and get your vaccine and a loaf of bread or whatever the case might be. So when the time does come where we have a COVID vaccine, I imagine we'll be some of the first medical professionals to get it and be able to start to distribute it in the communities.
And, when it comes time for things like that, does that have to be somebody that's already a customer, or can it be somebody who, maybe comes to Discount Drug Mart for the very first time?
Yeah, it can be anybody. Even today, we have customers who come in regularly to get a vaccine who have never gotten a prescription with us. So it doesn't have to be all or none. You could come into a Discount Drug Mart just to get one vaccine, and then you would, and then nothing else. Although, generally tend to retain customers once we have an opportunity to interact with them. But, or you could get your prescriptions with us and get your vaccine at your doctor's office, although most customers that we have would, I think, not choose that because they're already coming into us anyway, and they might as well, while they're there, just take care of all their medical needs that they can take care of while they're there. But back to the COVID vaccine, I think whenever that time comes where they have a vaccine that's safe and effective and ready to roll out for the general population, to answer your question, you wouldn't need to be an existing DrugMart customer to come in and receive that.
Okay, very good. Well, we are going to take a quick break here. And again, we're talking with Chris Peshek, Regional Pharmacy Supervisor, Discount DrugMart, and we will be back.
1480 WHBC has always been there for you.
We here at 1480 WHBC continue that work.
On your home of local news.
The 13th annual Alt Care Wish-a-thon, August 13th and 14th.
The money stays local. The money makes wishes come true. Wishes can happen thanks to you.
Masks on, Ohio. Stark County Sheriff George Meyer.
Pam would encourage your listeners not to call 911 where they should or shouldn't wear a mask, or if they want to report somebody that's not wearing a mask. That's not the purpose of 911, and we certainly don't want them to misuse that emergency service.
That helps a lot. People know not to call 911, and we don't want them to impede anything else that you and your folks are trying to do as well.
Get the facts from 1480 WHBC and WHBC.com.
Are you looking for the perfect vehicle for your family? Then see the Honda Odyssey minivan today at Wacom Honda. Right now, Wacom Honda has clearance prices on all Honda Odyssey models or 0.9% APR up to 60 months. Even better, Wacom has more than 40 in stock to drive home today. The Odyssey is U.S. News & World Report's best minivan for families. It seats up to 8 and offers tons of optional features like rear entertainment system, a built-in vacuum cleaner, forward collision warning, and blind spot warning. And today it's yours at Wacom Honda with clearance prices or 0.9% APR available. See it online at WacomHonda.com or visit Wacom Honda today, West Tuscan Lincoln Way between Canton and Massillon. Wacom Honda is family-owned and operated. They know what your family needs for a safe daily commute. New Honda Odyssey minivans with clearance prices and 0.9% APR up to 60 months. Do what I did. Save the Wacom way at Wacom Honda.
Hey, if you're looking to cut costs and free up some cash on a monthly basis, start today with Pure Talk USA. Now, the average family of 4 is saving over $800 a year on cell phone service by switching to Pure Talk USA. Now, every plan includes unlimited talk and text. And by the way, it just starts at $20. So switch to Pure Talk today. Just dial pound 250 keyword Pure Radio. Pure Talk USA, simply smarter wireless. You'll have the option to receive a one-time auto-dial text from Pure Talk USA.
Capital One knows life doesn't alert you about your credit card.
Hey, couch surfers, we've got nonstop tunes to keep you rocking while you work. Oh, and Colleen, yes, you Colleen with a K. Your free trial of Movie Plus ends tomorrow, and your card may be charged. Do you want to continue or cancel?
So meet Eno, the Capital One assistant. Eno looks out for surprise charges, like when free trials expire, and helps if you need to fix them. Eno, another way Capital One is watching out for your money when you're not. Capital One, what's in your wallet? Limitations apply.
Work at home. Work out at home. Second period math at home. Date night at home. Lately, we're doing a lot more at home, which means we're doing a lot less driving. With pay-per-mile car insurance from Allstate, you get the same reliable coverage you'd expect, but only pay for the miles you drive. Drive less, save more with Allstate. Visit allstate.com or call an agent for a quote.
Price also includes a daily rate, subject to terms, conditions, and availability. Allstate Fire and Casualty Insurance Company and its affiliates.
Come on, girls. It's time to take our recyclables down to the recycling drop-off site.
Should I grab these plastic grocery bags, too?
Well, sure. They're kind of plastic, so I bet they can be recycled. Drop that bag.
What the heck is that?
There. It is Recycle Man, and I'm here to fight the evils of recycling contamination.
Oh, no, you've got it all wrong. We're big recyclers.
And while that's commendable, you need to know that this is a bag full of plastic bags and tanglers.
What's wrong with plastic bags and tanglers anyways, Recycle Man?
Plastic bags and other tanglers get tangled in the sorting equipment at the recycling plant. Have you ever tried to remove hair from the vacuum cleaner wheel at home?
Well, he does have 5 daughters. You tell me.
Well, things like hoses, electric cords, clothing, bedding, and yes, plastic bags all get tangled.
But what about the plastic bags we filled earlier with bottles and cans?
Simple, just dump the bottles and cans straight into the bin and take the plastic bags home to use again and again.
Thanks, Recycle Man.
No problem. And remember, you too can be a superhero by recycling right.
This message brought to you by the Stark Tuscarawas Wayne Recycling District.
Hi, my name is Kyle, and I'm a pharmacist at Discount DrugMart, but that's not all I am. I'm a daughter, a wife, and a mother. I'm your neighbor, part of the community just like you. DrugMart is part of the community too. They have been for more than 50 years. Now, more than ever in these challenging times, your neighborhood DrugMart pharmacy, all of us, are here to help you. You can rely on us to go the extra mile, whatever you need, every time. I know in my heart that I can lean on my neighbors, and you can lean on Discount DrugMart.
1480 WHBC has always been there for you.
We here at 1480 WHBC continue that work.
On your home of local news.
Well, again, it is a Wednesday morning, and that means Spotlight today. It is Discount DrugMart, and we have with us Regional Pharmacy Supervisor Chris Peshek. And, you know, Chris, when we were talking just a few minutes ago, we were talking about vaccinations and talking about the coming of the COVID-19 vaccination. We hope soon, but putting that aside, there are still so many other vaccines that are very, very important, and people are, really thinking about that more than ever now. I mean, you think about trying to stay healthy. That's something you guys can help them with as well, right?
Right. Yeah, exactly. I think that while we might not have a COVID vaccine today, and like you said, hopefully that does happen in the future sooner than later, but the other vaccines that are available are just as important for a lot of different reasons. So, and we've seen an uptick in that as well. I think people are kind of sensitive to that now more than ever. I think infectious disease and vaccination is kind of on people's mind. And so just in the last few months this year compared to that same period last year, we've done about double the amount of vaccinations that we had done. And I think that's just a result of kind of the climate on everybody's mind. But some of the reasons why these other ones are so important, for example, like let's say pneumonia vaccine or flu shot, even though we're not quite to the time of the year where flu shots are being administered, that's usually more into the fall, but those kind of conditions, pneumonia, flu, number one, if somebody were to get sick with those right now in this period in history, they could mistake that for COVID and maybe think, okay, I need to go get tested. I need to go to the urgent care, even though it might not actually be COVID. I mean, we've had plenty of patients come in and say, I have a sore throat and a fever. And of course, right now, the first thing we say is you got to talk to your doctor, and they're probably going to tell you to go get tested for COVID. When it ends up being negative test and they had pneumonia or they had bronchitis or they had the flu or something along those lines. So by getting up to date on all your vaccines for those preventable diseases, you can decrease the number of false alarms you have, I guess is the way to say it, for COVID.
Yeah.
And the other thing, which is kind of equally important, is that COVID is out there, and there is, you have that chance of contracting that. And as we've heard from all the data that's out there right now, if you have other condition at the same time, COVID could hit you even harder. So some of those conditions are chronic, like diabetes or a breathing condition, but some of them are infectious. Like if you have pneumonia with COVID, your chance of having a significant problem is higher. Or if I'm guessing that as we get into flu season, if you happen to contract the flu and COVID, the chance of some kind of complication is higher. And so by preventing the diseases that you can prevent, you're cutting down on the chance that you're going to contract two things at the same time, which is going to be a lot harder for your immune system to fight off.
Yeah, one of the things that we talked about on my show earlier this morning was a study that came out from the National Alzheimer's Association saying that people who get a flu shot are actually 17% less likely to get Alzheimer's. So maybe a new incentive for those who don't get a flu shot to get in there and get one. That could be a good opportunity.
Yeah, I mean, it's so, interesting maybe isn't the right word because it's kind of can be scary too, but I guess it's both about all the things about infectious disease that we don't quite understand. And COVID happens to be the hot topic right now, but really all infectious diseases, you think about the primary symptoms where the cough, the fever, the sore throat, the wheezing, the feeling really tired, those kind of things. But the things that aren't as well understood are the long-term issues. So are there issues with, if somebody gets pneumonia younger, are they more likely to develop asthma later in life? Or now we kind of know with chicken pox, if you got chicken pox as a kid, now you're at an increased chance of developing shingles as an adult. So it's kind of those long-term things that aren't as well known. So to your point about the Alzheimer's, is it possible that if you get the flu that somehow that affects something where it puts you at increased risk of dementia or Alzheimer's later? That kind of long-term studies, we just don't have that information.
Yeah.
But right now we're just, from our standpoint, we're just having conversations with our customers about vaccination for the vaccines that do exist today. And in some respects, this upcoming flu season is probably going to be one of the more important ones we've had in a while, maybe ever since, swine flu or something. But because of the reasons we already mentioned, that you don't want to get two things at once and you don't want to mistake the flu for COVID. So getting a flu shot helps with that. But the last one, and this is kind of more of the greater good kind of thing, is that we don't want to overtax the healthcare system. We've heard a lot about that too. Like we want to flatten the curve, only have so many hospital beds. So if COVID continues to keep up what it's been doing through the fall, the last thing we want to do is have patients with the flu going into the urgent care, going into the emergency room, getting admitted to the hospital, because that's just going to tax the healthcare system even more. So the more patients who can get vaccinated against the flu, the less likely that the flu is going to create additional strain on our resources in the greater healthcare system.
So if somebody wanted to find their local discount drug mart, their location, how can they go about doing that?
There's a lot of different reasons. I think probably the easiest one is to go on our website, discount-drugmart.com, and there's a store locator. And we're pretty much all throughout Northeast Ohio. I don't know, if you have listeners that aren't familiar with us, we have 76 stores spread across Northeast Ohio, some in Columbus, some in Dayton. But I would say the easiest would be that. Now, if you're not internet savvy or if you don't have access to that, then you could also, give us a ring, or obviously Yellow Pages is still an option. Is that? But we can direct you to the closest store. But I would say, the easiest is just on our website, store locator.
Honestly, you just have to drive down the street because you'll see one. I see them all over. Well, we're going to take a quick break for news. And when we come back, we'll talk more about that. Also, we're going to talk about syncing your meds and what your pharmacist can do for you and how important that is. And that is all coming up on Spotlight on WHBC.
News Talk 1480 WHBC and Mix 94.1 invite you to save the day.
The 13th annual All Care Wish-a-thon, August 13th and 14th.
Hi, I'm Katie. I'm a pharmacist at Discount DrugMart, but that's not all I am.
I'm a wife and a mom to 2 sweet girls. I see the people of our community every day. They have questions, and honestly, they're concerned about their health and medications. So they come to DrugMart Pharmacy just like their parents did, because they know we will always help them. Whatever they need, whatever questions they have. My fellow pharmacists and I are proud and truly humbled that you have put your trust in us during this challenging time. Discount DrugMart is here for you, always.
Want to turn your old, rusty hunk of junk in for a nicer ride, but think it's not even worth a tank of gas? Think again. Progressive Jeep Ram will give you $5,000 for your trade, no matter the condition. That's right, $5,000 for any trade, guaranteed. When you buy any factory-certified pre-owned car, truck, or sport utility at Progressive Jeep Ram in Massillon. Needs repairs? No problem. Any rusty, smelly, noisy hunk of junk gets you $5,000 guaranteed. $5,000 could help you get approved. No other dealer will give you $5,000 for your cruddy car, but Progressive Jeep Ram will, guaranteed. Get $5,000 for your trade only at Progressive Jeep Ram in Massillon. One trade per purchase. Offer applies to Chrysler, Dodge, Jeep, or Ram certified vehicles only. Does not apply to prior transactions and cannot be combined with any other advertised offer. See dealer for details. Ends July 31st, 2020. Get $5,000 for your trade only at Progressive Jeep Ram in Massillon.
At Packley, we pride ourselves on serving families in Massillon and the surrounding areas with dignity, respect, and compassion. Recently, our country and the world has been tested. As funeral service providers, we don't have the option to close down because there wouldn't be anyone to take care of your loved ones who pass away. Here at the Packley Funeral Home, serving our families is our number one priority. But with the ongoing issues with COVID-19, so is the health and wellness of those we serve as well as our staff. It would be a disservice to our community if we engage in the pandemonium. So we will continue business as usual while also following state and local guidelines. We provide hand sanitizer in both chapels, place any signage about limiting social distance if a family requests it, and we will be thoroughly cleaning the funeral home with the new CDC guidelines after funerals and visitations. Visit us at 1100 Wales Road Northeast in Massillon or tour our facility online at packley.com. Packley Funeral Home, serving our community with grace and compassion.
Hi, this is Jim Snyder of the Your Wealth, Your Retirement Program, a financial education show for those seeking guidance. Are you retiring soon? Are you in the middle of changing jobs? Maybe you're just done with all of that risk in the 401k plan and you'd like to have a discussion about an early rollout. Maybe you're 70 and a half and you're in your income phase of your IRA. We can help you with all those. Give us a call at Senior Financial Group at 800-639-0824. That's 800-639-0824.
Need a water cooler in your home or office? Rent a brand new cooler from Burndale's Water Center for just $8.75 a month. And check out our 5-gallon reverse osmosis water, just $4.50 a bottle.
Burndale's Water Center.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Governor Mike DeWine announcing a major change for daycares yesterday. He says they will be allowed to fully reopen in 2 weeks with normal class sizes. They will still be required to follow all health guidelines and requirements. McDonald's has announced it is permanently closing 200 locations across the U.S. as the fast food chain's revenue fell by 30% over the last 3 months. More than half of the 200 soon-to-be shuttered McDonald's are located in Walmart stores. The Ohio High School Athletic Association announcing that fall contact sports will be allowed to start practicing on August 1st, which is this Saturday, but all scrimmages against different schools are suspended. They could remain suspended going into the actual season. Florida has broken yet another coronavirus record, reporting 186 COVID-19 deaths in one day. The number marks the state's highest single-day death toll since the pandemic began. Well, it looks like the country has recovered at least some of its missing coins. In response to the U.S. coin shortage, a Wisconsin resident gathered up all the change he found around his house and cashed it in for $5,300. Jeopardy! And Wheel of Fortune are about to resume filming, and fans will notice some changes. Wheel is redesigning its wheel to ensure contestants are 6 feet apart, while on Jeopardy, the podiums will be spaced out. Also, everyone taking part in the game shows will be tested for coronavirus. More news coming up at 10 o'clock. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. A warm day, partly sunny. The high today, 89. It'll be partly cloudy tonight, low 67. Tomorrow, Friday and Saturday, partly sunny for each day. The high tomorrow, 85. Friday's high, 83. And then the high Saturday near 84. Clouds and a bit humid on Sunday. Occasional rain and a thunderstorm. The high Sunday near 81. I'm Steve Williams for News Talk 1480 WHBC.
1480 WHBC has always been there for you.
Thank you for being a voice of calm and correct information in a world of chaos and misinformation.
News Talk 1480 WHBC.
Many of us have been sitting at home wondering, where could I go in Stark County and it be safe? From Visit Canton, Tanja Marshall.
Good morning, Pam. On that Stay Safe in Stark County page is a link to Restart Stark. The businesses that are taking the pledge know that visitors are specifically looking for you to be following guidelines. And if you're not, there's also information on that page for them to report it in line with the Responsible Restart Ohio guidelines.
Visit Canton.com and it's Stay Safe in Stark County. And Tanja, thank you so much.
Thank you, Pam.
Hi, I'm John. I'm a pharmacist for Discount DrugMart. But that's not all I am. I'm a healthcare provider, good listener, and a problem solver. I've been a pharmacist for DrugMart for over 30 years. That's a long time to get to know your patients. And each week we hear as many concerns as there are patients. Just the other day, I special ordered a medication for Mrs. Briscoe, just to make sure she didn't miss a dose. I'm proud that our patients trust me with their pharmacy needs, and I promise that Discount DrugMart will always be there for you.
1480 WHBC has always been there for you.
We here at 1480 WHBC continue that work.
On your home of local news.
Well, welcome back to a Spotlight on this Wednesday morning. And today we're talking Discount DrugMart. We have with us Chris Peshek, who is Regional Pharmacy Supervisor. And, Discount DrugMart has been an important part of the community for a very long time, but more now than ever, we will say. And Chris, I wanted to, before we step away from talking about the immunizations and things like that, and move on to another topic, I do want to ask you, if someone is planning to come to get an immunization, what's the process? What can they expect when they get there?
Yeah, we try to make it as quick as possible. I mean, before COVID, we try to make it as quick and efficient as possible. Now we even more so, because a lot of people don't want to be hanging around in a public place right now. But essentially, there's one form to fill out. In some cases, you can fill that out at home. If you have access to the internet and a printer, you can do that at home. If not, we provide you one when you come in. With everything going on right now, we will check your temperature just to make sure you don't have a temperature, because in order to administer an immunization, the pharmacist and the patient need to be in close quarters with each other, granted only for a minute, but still we want to make sure that everybody's safe, both our employees and the customer. So check your temperature, fill out this one form. We bill your insurance for you if you have insurance, which most of our patients have an insurance that covers their vaccinations. Administer your vaccine. You can stick around there for a minute if you'd like, so we can just make sure you're not having any side effect to the vaccine. Some customers prefer not to do that right now, and that's okay too. But that's about it. So one piece of paperwork, bill your insurance, take your temperature, and get you out of there.
And no appointment necessary, right?
Correct. Yeah, no appointments necessary. Some customers like to call because they can then find out the time of day when we're least busy. There's going to be the least amount of people around the pharmacy, and that's fine. We're happy to, work around your desires or needs, but you don't need an appointment at all.
Okay, that's good. That makes it nice and simple.
Yep.
Talk a little bit about a service you call Sync Your Meds. What's that all about? Yeah,
so similar to getting people in and out for their vaccines, we try to get people in and out with their medications as quick as we can and as efficiently as we can. So for about a decade now, we've been doing this Sync Your Meds service, and the short version is basically we arrange for all of your prescriptions to run out on the same day. And for most customers, we can have that happen with 100% of their medications. So we might have to do something where we short fill a prescription. We kind of have some ways of manipulating the prescription so that they all eventually run out on one day. And then you come in on that one day, you pick everything up you need for an entire month's worth of medications. You go home, you don't have to come in again for another month, and then you come and get those other prescriptions. So that's been a convenience thing that we've done for a decade, but the amount of customers requesting that now, as you might expect, has gone up, and it's become an even more important part of our business because instead of coming out into public 3, 4, 5 times a month to pick up medications, now you're coming out once. So you're minimizing your trips out. It's making it more convenient, and it ends up being good for everybody because we know when you're coming in, you come in, you get everything for the month, and then you're kind of set. So, and with the free delivery, now you can even have that delivered if you don't want to come in at all. But most customers at least once a month need to come in and get some staples, so they come in and buy those when they pick up their monthly order.
Man, that I got to tell you, like you said, even before COVID, that's a fantastic thing because, I have prescriptions, my mom has prescriptions, my son has everybody, and it's crazy. You feel like you're just going back and forth all the time, and to have that service, that would be awesome. So do you just have to ask for it and it'll happen, or how does that work?
Yeah. I mean, sometimes we'll identify a customer that we think could benefit from that, and we'll bring it up. But in most cases, a customer will just kind of come up and say, "Could I take advantage of that service, or do I have to apply for that service?" And the answer is no. Just last week, I was working at one of our pharmacies, and I noticed that I was filling a prescription for a patient who was a mom. And she had her prescriptions, her daughters, her sons, her husbands.
Yeah.
Between the 4 of them, I think like you had mentioned, she was probably coming into the pharmacy 4, 5, 6 times a month. And not that was terribly inconvenient because we have a drive-through and we try to be quick about it and that kind of thing. But what we did for her is took all 4 family members and had them run out on the same day. And so with 1 trip per month, she got everybody's medications and then was good for the month. So, like I said, before COVID, we tried to do it just as a convenience thing. Now we're doing it still as a convenience thing, but also potentially a health service as well, because you're not coming out quite as much.
Yeah, that's pretty awesome. I love that. What about the free delivery? When it comes time for that, is that something you have to sign up for ahead of time, or just can request? How does that work?
Request. So, for example, again, last week we have a customer who, she always comes in to pick up her medications because she likes to buy groceries and say hi to everybody because we have that relationship with her. But this past week, she was a little spooked out by the rising cases of COVID in her particular county, and she said, "I really hate to come out." And so we said, well, why don't we just deliver it this month? So we set that up, delivery for the same day. She got her medications later that afternoon. And I imagine next month, if she's feeling a little more confident about coming back out, we'll see her again. And so it doesn't have to be, again, all or none. It can be delivery this month and no delivery next month, and whatever the customer needs to make them feel comfortable and make life easy for them.
When we began the program this morning, we were talking about COVID-19 and Discount Drug Mart's response to that and how you guys are handling it for your customers and your employees. Maybe we'll go over that again, just because if somebody is just tuning in right now, everybody wants to feel safe, obviously, when they go and have to do things like pick up their prescriptions and things like that. So you guys are really working hard at that.
Yeah, and I don't know if I mentioned this earlier in the program or not. One thing that we've rolled out recently, and again, these are all things we've been working on, of course, but COVID-19 has sped up a lot of our plans. And one of those was the buy online, pick up in store option. So based on customer feedback, some customers, especially now, but even before, had said, it would be nice if I could shop your stores online and then just kind of walk in and my order was sitting there and I could pay for it, pick it up and go. So that's something that I think we have live at about 80 to 90% of our stores today. And then by the end of this week, we're hoping to be 100% where you can go on our website, purchase your products, they get pulled for you, bagged, and then you come in, grab the cart, and take it out to your car. Or at some of our stores, they even do curbside delivery. They load it into your trunk, and away you go. So that's one thing that we've been doing to try to help our customers if they don't want to come into the store and they still want to shop and get what they need. And I think we already talked about the free delivery that we're doing and the designated hour every morning from 9 a.m. to 10 a.m. for at-risk customers. So it's definitely been an interesting 6 months. It's required a lot of creative thinking and problem solving to try to meet the needs of all of our customers, employees, government officials, et cetera, et cetera.
Yeah, we all have been coming up with new ways and reinventing ourselves, so to speak, to be able to meet the needs during a time like this. So that's important.
Talking digitally, so.
Yeah, exactly. Well, we are going to take a quick break, and when we come back, we're going to talk more about Discount Drug Mart, the locations, how you can find one, where you can visit, and all of the wonderful services that they provide. Again, right here on 1480 WHBC.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
Hi, I'm John. I'm a pharmacist for Discount Drug Mart. But that's not all I am. I'm a healthcare provider, good listener, and a problem solver. I've been a pharmacist for Drug Mart for over 30 years. And that's a long time to get to know your patients. And each week we hear as many concerns as there are patients. Just the other day, I special ordered a medication for Mrs. Briscoe, just to make sure she didn't miss a dose. I'm proud that our patients trust me with their pharmacy needs, and I promise that Discount Drug Mart will always be there for you.
You know that big quarterly meeting coming up? Nope. Doesn't ring a bell.
This moment was brought to you by Geico Motorcycle. 15 minutes could save you 15% or more.
When you're injured playing sports, come to Omni Express Walk-In Clinic for fast, expert care. They will assess your injury with on-site MRI and digital X-ray, then move on to immediate treatment using non-surgical therapies, medicine, or injections for pain relief. If needed, they can plan for surgical repair and then follow up with physical therapy for a seamless transition from injury to repair to functional recovery. Walk in today. Omni Orthopedics Express Walk-In Clinic. 4760 Belpar Street in Belden Village. OmniOrtho.com. 330-492-9200.
Progressive presents The Sounds of the Old World. The year is 2019, and someone is waiting for the previews to start in a movie theater.
Hey, you want anything? Popcorn? Soda? No, nothing?
This has been The Sounds of the Old World. Brought to you by Progressive, where drivers can still switch and save like it's 2019.
Quote today at Progressive.com. Progressive Casualty Insurance Company and Affiliates.
Need groceries today? No problem. Shop for groceries anywhere with Fisher's To Go same-day curbside pickup or delivery. Order on FishersFoods.com or on the app. From your local favorites to everyday low pricing and weekly savings, this easy online service provides 24/7 access to all the brands you love. You can be confident Fisher's follows all the safety guidelines. So not only is this amazingly convenient, it is also very safe. Fisher's To Go at FishersFoods.com or on the app. Stay safe and let Fisher's do the shopping for you.
Paid non-attorney spokesperson. The Ted O'Neill Law Firm with principal office in Houston, Texas is responsible for the content of this ad. Non-Hodgkin's lymphoma is one of the most common cancers in the United States. If you or a loved one was diagnosed with non-Hodgkin's lymphoma and were exposed to Roundup weed killer, you could be entitled to cash compensation. Bayer, the owner of Roundup, will pay more than $10 billion to cancer victims of weed killer Roundup. Call our weed killer cancer hotline now to see if you are entitled to cash compensation. Roundup has been one of the most commonly used herbicides in the U.S. If you or someone you love has been diagnosed with non-Hodgkin's lymphoma and exposed to Roundup, call now. Our attorneys have the experience and specialize in fighting for everyday people to get you the compensation you deserve. If you or a loved one has been diagnosed with non-Hodgkin's lymphoma and were exposed to Roundup weed killer, even if the loved one has passed away, call 800-586-2146 now to see if you are entitled to compensation. But hurry, time is limited. Call 800-586-2146. 800-586-2146.
Geico. 15 minutes could save you 15% or more on motorcycle insurance.
Love the show. Thank God for radio. I don't know where we'd be without it.
I listen to you daily. Your station is so informative.
News Talk 1480 WHBC.
And today's spotlight, Discount DrugMart, and we've been talking about all the wonderful services they offer. Some very unique things that I think maybe you didn't realize that they do offer. And we have with us from Discount DrugMart, Regional Pharmacy Supervisor Chris Peshek. And I also, before we get back to our discussion here, Chris, do want to mention discount-drugmart.com. That's the website. If folks want to go and check out the locations there and find out if they can get online ordering and curbside pickup and just kind of check out the website and the weekly ads and see all the different things that you guys have to offer. It's a great website. And you can check that out, discount-drugmart.com. So let's talk a little bit about Discount DrugMart itself and maybe the history. You guys have been around for a while and obviously a big part of a lot of communities here in Ohio.
Yeah, that's always kind of been our MO, is trying to be really engaged with the communities that we work and live in. I think we try to embody that in the way we do business and in our marketing and in our charitable giving and all that kind of stuff. The founder of the company was a pharmacist, Mr. Bujay. He has since passed on, and his children are kind of running the show here and doing a great job. But he was always big into that, taking care of customers, making sure customer service was a priority, being engaged in the community. And so that's just kind of in our DNA. We've just kind of continued with that, even in his absence.
Yeah, it seems like when you have, DrugMart in your name, obviously that's a big part of it, but it's not just a pharmacy. I think probably we ought to make that clear to folks as well who maybe aren't familiar.
Yeah, I think hopefully a lot of your listeners in the Canton area have been into a DrugMart. We have a couple, I think we have 4 or 5 stores right in that area, but if they haven't, to your point, yeah, it's much more than just a drugstore. One of our little jingles is we have everything you need. And if you've been in one, you've kind of seen that, where we have everything from furnace filters to deli meat to makeup and video rentals and charcoal. And, it's kind of in between a traditional drugstore and a grocery store. So a little bit of everything. But we just had our 50th anniversary last year. And so that's really nice to see. We got some staying power, planning on being around for another 50 years. And just in Ohio. So we're just an Ohio business. And we have, until recently, we were family owned and operated. I had mentioned the founder had passed that on to his children. And then just within the last couple of years, we're transitioning to be an employee owned and operated company. So that started about 3 years ago, and that's transitioning into being employee owned. So that's kind of neat. I think I had mentioned I've worked for a couple different companies, and this definitely has a different feel. It's got that family feel to it, that community feel. So I've really enjoyed being here.
Yeah, when you said, it's like a one-stop shop, you were almost going to make me sing the jingle, weren't you? I think you were. It saves you the runaround, right? I sing it every morning. The commercials come on and I sing along with it every morning.
As an employee, I think it's a requirement of employment to be able to sing the jingle. So.
Yeah, absolutely. I mean, and that has to be a good thing, I would say. I mean, and you are an employee, obviously, and that has to be a good thing when, in this day and age, especially, that you look around and you see a company that cares about their employees and cares about their customers and kind of, fosters that relationship through all of the things that they do.
Yeah, it's real. Whenever we hire somebody new, one of the things I always like to tell them, which is a sense, gives me a sense of pride with the company, is that when it comes to pharmacists specifically, we have more pharmacists that have been with the company 10 or more years than we have that have been with the company 9 or less. So it's kind of from what I understand, that's a pretty unusual statistic in this day and age, to have more employees that have been with you over a decade than under a decade. So I think that says kind of a lot about our culture and kind of how we do business.
Yeah, it sure does. Absolutely. Well, and I often say and hear, and as you mentioned earlier about being the immunization destination or vaccination destination, and it's a place to go and make sure that you stay healthy. And we'll kind of circle back to that a little bit, because I think it's real important. We don't have a COVID-19 vaccination right now, but we sure have a flu shot and a pneumonia shot and all of the other ones that folks need to get to stay healthy. You guys offer all of that.
Yeah, and I think that comes back to, like you said, that while we don't have the COVID vaccine developed yet, that you should work to prevent what you can prevent, not only for your own health. I mean, obviously that's the primary motivator for most people, is to stay healthy, but also to do your part to prevent overtaxing the healthcare system by coming down with a condition that could be prevented by a vaccine. We try to make sure all of our customers, and even people who maybe aren't our customers at this time, to let them know that we can be an immunization destination, as you said, and that you can come in and any vaccine that's available, that we're authorized by the state of Ohio to administer. If you're a candidate, we can get you set up with that so that you can be as healthy as possible.
Chris Peshek, Discount Drug Mart. We appreciate you coming on this morning. The website is discount-drugmart.com. Folks want to find a location or more information, they can do that.
You got it.
Thank you.
Thank you.
$14.80 WHBC has always been there for you.
We here at 1480 WHBC continue that work.
Find more right now on WHBC.com.
We're all spending a lot more time at home these days, hashtag COVID-19. So don't forget to say, hey, Alexa, play 1480 WHBC.